This video program is going to show you how to use Puregon with the Puregon Pen. For full prescribing information, please contact your doctor, check the instructions for use, or check the package insert in your cartridge pack. Before your first injection, please familiarize yourself with the pen. Please read the package insert for further information. As with all drugs, effects such as bruising, swelling, pain, redness or itching may occur at the injection site, nor do they last very long. Before proceeding to the preparations for the actual injection, this is what you will need for the injection: a Puregon pen, a Puregon cartridge, a needle, some disinfectant, gauze or swabs, and a sharps disposable bin. Puregon cartridges should be stored in a safe place. The refrigerator is a good storage place. Puregon, however, should preferably be administered at room temperature. If you decide to keep it outside the refrigerator, please remember that you can only store it for to a maximum of 25 degrees centigrade. Puregon cartridges are available in two strengths: 300 and 600 international units of recombinant FSH per cartridge. The colour of the metal cap indicates the contents of the cartridge. In this video, we will demonstrate the 600 IU cartridge. Your doctor will have prescribed the right cartridge for you. Always wash your hands before you start. At the start of your Puregon treatment, and each time you need to change a Puregon cartridge, you take the Puregon pen. Remove the cap from the pen by pulling it off gently. Unscrew the body from the cartridge holder and put it aside. Insert the Puregon cartridge into the yellow cartridge holder. Make sure that the metal cap goes in first. Now screw the body onto the cartridge holder with the cartridge in it. Tighten firmly, but do not over-tighten. Check that there is no space between the body and the cartridge holder. If there is space, on the cartridge holder and check whether the cartridge has been inserted correctly. The following steps should be performed every time you use Puregon with the Puregon. Use a new sterile needle for each injection. The cartridge holder must have a cartridge in it before you carefully remove the inner needle shield and discard. Hold the pen with the needle pointing upwards. Knob 1 mark on the dose scale. You'll hear a click. With the needle pointing upwards, press the orange injection button fully out at the tip of the needle. If it is complete. For doses from 50 to 450 IU, turn the dosage knob until the dot. If you dial too far by mistake, do not dial the reverse side to correct it, because you will waste fluid. Continue to turn the dosage knob past the 450 mark, as far as it will turn. Completely push in the end of the orange injection button. It slides in very easily. Puregon is designed for injection under the skin. Suitable places for injection include the abdomen or upper leg. Your doctor or nurse will advise the best place for you. Try to vary the site of injection just a little bit each time. Use a swab or piece of gauze moistened with disinfectant to clean the area where the needle will be inserted. Let the disinfectant dry for a moment before proceeding. Pinch the skin a little. With the other hand, insert the needle at an angle of approximately 90 degrees into the skin's surface. Fully press the end of the orange injection button. Wait 5 seconds before removing the needle from the skin. Pull out the needle. Gently cover the injection site with a piece of gauze moistened with disinfectant. Congratulations! You have now successfully administered your Puregon dose. Place the outer needle shield Your Puregon pen is already loaded, and all you need to do is attach a new needle. In order to prepare for injection, you have to dial 1 mark on the dose scale. You hear 1 click and should dial the recorded position on the dosage scale. Inject the prescribed dose. By keeping records of the injections, you can see whether there is enough drug left in the cartridge for your next injection. If you realize before starting the injection that you do not have enough drug in your Puregon cartridge for your dose, you have 2 options. You can either dispose of that cartridge and change to a new Puregon cartridge and take your dose, or dial the prescribed dose. You can finish the Puregon cartridge which is in the pen, followed by reloading the pen with a new cartridge and taking the remainder of your dose from that new Puregon cartridge. If you realize too late, in other words, after starting the injection, that you do not have enough Puregon in the cartridge, you must also take the remainder of the dose from a new Puregon cartridge. You will see that the dosage scale does not go all the way to 0 after setting and injecting the prescribed dose. The number in the dosage window will not reach 0. If you have not injected the complete dose, remove the pen with the needle attached from the skin, and then detach the needle from the pen. Write down the position of the arrow on the dosage scale at the point where the pen stopped. This means you are recording how much Puregon is still to be injected. Remove the empty cartridge. Then load a new Puregon cartridge and prepare the pen for injection, as shown previously. Dial the recorded position on the dosage scale. Inject the remainder of the prescribed dose. Before removing the empty cartridge from the pen, the needle must always be removed. Unscrew the body of the pen. Put down the body and remove the empty Puregon cartridge from the cartridge holder and place in the Sharps disposable bin. You can now either prepare the pen for loading the next cartridge or reassemble the Puregon pen. If you have any questions about Puregon, write them down and ask your doctor or nurse during your next visit. Treatment of infertility can often be very demanding. Hopefully your treatment with Puregon by the Puregon pen will lead to a successful pregnancy.